Hi everyone, it's Dr. Dave, and I am coming to you this week, Thursday Medical Minute, with just some thoughts that have been on my mind recently. So, as a practicing cardiologist, I see lots of patients who have high cholesterol. And when I first started practicing 15 years ago, if you had high cholesterol, there's a very good chance if you failed diet and exercise after 3 months, you were going on a medicine. Now, I know I'm leaving out a lot of details here. We don't know exactly how high the cholesterol is. We don't know the ratio, but let's just assume for argument's sake, it's a little high and the ratio, the good cholesterol is not particularly low. What do you do? Should you be on a medicine if you're struggling with your diet and exercise? Well, as my career has gone on, I have realized that that is not always the answer. Just because you have high cholesterol does not condemn you to disease, heart disease, or strokes. And by the way, just because you have normal cholesterol, does that mean you are protected from heart attacks? I'm going to tell you a very scary statistic. 2/3 of patients presenting to the hospital in a very large study were found to have normal cholesterol even though they presented to the hospital with heart disease. 2/3 of patients with heart disease presenting to a hospital had normal cholesterol. So what does that tell you? That tells you that the cholesterol is important, but it's not the whole picture. You can absolutely have quote unquote normal cholesterol and still have a lot of cholesterol building up. So what I would ask you to bring up with your physician or your healthcare provider or your cardiologist is, if you have high cholesterol, do you have cholesterol building up in the arteries? Do you have cholesterol in your carotid arteries? Do you have cholesterol in your heart based on a coronary calcium score, a coronary CAT scan, or an angiogram? Do you have cholesterol building up in the blood vessels in your chest or your belly? Do you have cholesterol building up in the blood vessels in your legs? I would strongly suggest that you need to be screened for cholesterol building up before you decide at what level your cholesterol should be treated, if at all. Okay, everybody, until next time, this is Dr. Dave.